In 1847, the Italian chemist Dr. Sobrero mixed nitric acid with glycerol and developed a new compound known as nitroglycerine. It was extremely unstable and volatile, but all good scientists in those days, he tasted it. It was sweet, but it gave him a pounding headache. This is the first sign of nitroglycerine's effect on blood vessels. But he shelved the idea because it was too volatile and unstable. Enter Alfred Nobel. So he's the guy with the prize named after him. Alfred Nobel stabilized the nitroglycerine and developed dynamite. He made a lot of money from dynamite, but he felt a bit guilty later in life, so he donated all that money for the Nobel Prizes. Now, in the dynamite factories, workers would be exposed to nitroglycerine. Early on, they would get the headache and the drop in blood pressure because it would dilate blood vessels. But these workers would eventually get tolerance and it wouldn't have an effect on them. But when they were away from the factories, like weekends or holidays, they would get a withdrawal effect. And there was a term known as Saturday night angina, where they would get chest pain because their blood vessels in their heart would start to get smaller again, or vasoconstrict. So this was the second sign of how nitroglycerine might have a use in the blood vessels of the heart. Now, drug makers refine nitroglycerine into a compound known as GTN, or glycyl trinitrate. We use this today to treat angina and prevent heart attacks. Now, interestingly, one of the first persons to be prescribed GTN was Alfred Nobel for his own angina. So the guy who developed dynamite and has a Nobel Prize named after him, he and his own compound was his treatment for his own angina.